The Delta State Contributory Health Commission, they don't come again to remind all pregnant women when they for inside Delta State, say make they go register with the Delta State Contributory Health Commission scheme and get their health card. Even all pikin when they for 0 to 5 years must also register and get their health card before they go get any kind of treatment for our hospital. Because from now on, it go be say no health card, no free treatment, no health card, no free antenatal, no health card, no free delivery. Now the Delta State Contributory Health Commission, now they bring on this ogbonge tori o.
Hello, and thank you so much for joining us on the program Delta Health Insurance Scheme and You. I am your host, Eunice Emiazia. Lined up in this week's episode is a news update of an activity of the Commission, the Delta State Contributory Health Commission. And then we go on a short break. Well, we'll come back. We'll follow immediately with the main dish for today. So we'll be speaking with the Director General and Chief Executive Officer of the Delta State Contributory Health Commission, Dr. Isaac Akpoveta, and he will be sharing insights that will be very valuable in today's episode. So stay tuned. I would be right back.
Zone 2, a big berry, Nakmak na Modiaye. Totika bag Bilico Mabalabanek ba Membelaba. Delta State Contributory Health Commission a Bilicom. A berry batragaboma, oh, Kelemo, Como, or from Brumere, or from Brumere. It no frame Kemas, Manai Dentos Avarakum, and I get about Funkuapa. Mosi Camera Film, a common number, Fuma Maraba, Manipulated Zide, by a black by a Coafi. Bandy or Bora Barbara, Mam Karamek Bilme. Ayapere ye, yapere ziwe now, or Kakamai, 10 to Zaramu, Alagakum Gapanake, Osia Pare, Tubom, Brevafum, Berescom, Amusa Gagatuboma, Zorakane, and Niboko, Pinboko Fi. The Bram and Brahman, nobody Bram Okakum, Alagakum Gapai, Nakma Bana Modiai, he like Billy, the Bilma Brapo too, and egg Bam and Brava. Delta State Contributory Health Commission.
The Delta State Contributory Health Commission has extended the Tertiary Institution Social Health Insurance Program to the Delta State Polytechnic, Ogoashioku. This follows the successful launch of T-SHIP at the Denis Osadebe University and the University of Delta, Abo. At the official flag-off ceremony, the Director General of the Delta State Contributory Health Commission, Dr. Isaac Akpoveta, described the event as a reaffirmation of the state government's commitment to its MORE agenda, with a focus on creating opportunities for all. The DG, represented by the Director of Planning, Research, Statistics and ICT, Mr. Emmanuel Akpofure, emphasized that the initiative is a strategic step to ensure structured health coverage within Delta State academic institutions. The DG reiterated the Commission's commitment to delivering quality, affordable, and sustainable healthcare services across the state.
This gathering is emblematic of a deeper commitment by the Delta State government to deliver on the MORE agenda of His Excellency, Right Honorable Sheriff F. O. Oburewori, with a sharp focus on opportunity for all. So the T-SHIP represents an operationalization of this agenda within our tertiary institutions. A strategy that safeguards students' health while advancing universal health coverage among our youth demographic. Following successful pilot launches at Denis Osadebe University, Asaba, and University of Delta, Akko, today's flag-off at the Delta State Polytechnic of Ogoashioku further cements our dedication to extending structured health coverage to the hearts of Delta's academic community.
The rector of the Delta State Polytechnic, Ogoashioku, Professor Emmanuel Atruenu, said any nation or individual desiring meaningful development must prioritize help. Professor Atruenu, represented by the Deputy Rector, Dr. Joy Ahon, urged students to take full advantage of the program. In Ogoashioku is Hamzat Kelly Precious reporting.
Koko, onukoko me ugbofife. nrohe ndị Delta State Contributory Health Commission si ni welego again anya ha ni ndị kpo rechani amụ nwa ni mpopo wa mani ni gan fiewe wegbon so agbari contributory health card esisiwe ni iwuro ni nwe ka rechani ga ahụsen lwali jekos kode nwo contributory health card emu ga kuma we nele emu kuma go we ikebe weru esi ulogbon da choma kwa card nwe gi jen ulogbon wule okwu ndị niile nwa ni amani nwo contributory health card ya na ka nzuzo ofe amani nwo contributory health card government efe ekwenya amani nwo contributory health card ọmụmụ nwa awụkọ fe ozidi ya eka ndị Delta State Contributory Health Commission bịanụnụ ọnụ kọkọ mee ogbu ọfịfị.
All right, so thank you so much for joining us on the program today. Tell us your name and give us an insight on how far the Delta State Contributory Health Commission has fared under the administration of Governor Sheriff Oborowori.
Yeah, my name is Olurogun Dr. Isaac Akmoveta. And well known to you, I'm the Director General of the Delta State Contributory Health Commission. Well, if you recall the MOA agenda, meaningful development, opportunity for all, realistic reforms, and enhanced security and peace. The Commission stride about three of those key delivery areas of the government. First, human capital development. We all know the concept of health being wealth. And so this government ensure that Deltans are well. Going to 45% of Deltans have been enjoying one form of health insurance or the other. A very low cost, yet high quality care. And so the government have done well. The commission is the one carrying out those policies of government. And so we fit in very clearly. And I'm happy to be here to ensure Deltans are healthy and therefore will become wealthier. And so the more agenda, the concept of the governor to ensure Deltans benefit more from the services of government is being carried out by this commission.
Okay, sir, you have served in this commission since its inception. Now we know there are challenges in the implementation of health insurance across the globe. How have you been able to navigate these challenges?
The challenges are two in health insurance. Access. Can the people afford? And the access is two components. Financial access and physical access. And so if you want people to key into health insurance, you must look into these two challenges. Access, financial access, that people, do they have the money? Government is gracious enough to ensure that the premium to key into the scheme in Delta State is the lowest in the Federation. 7,000 naira. Pay 7,000 naira as a vulnerable individual, you access quality health care for a whole 1 year. The lowest in the whole Federation, none again. And so financial assets have been taken over by government. Government subsidized that 7,000 extremely. Many treatment from everyday malaria, whatever it is, to admission, to cesarean section, to even herniorrhaphy operations. Free antenatal care with 7,000 naira. So you can imagine the access, financial access that the government have granted to Deltans. And then we have the physical access. Delta is one of the only states that have so many health facilities in almost every village. Before you cross two villages of less than 2 kilometers, there's a health facility, at least a primary health care center. And then general hospitals everywhere. And we have 11 medical zones in Delta State. Each of them about 10 hospitals, general hospitals in each of the zones. At least to every headquarter of a local government in Delta State have a general hospital and a central specialist hospital. Quality of care is a challenge. I want to say health insurance is a new concept in this part of the world. In medical school, we're not taught health insurance. I must be frank with you. Some of us have become consultant in health insurance, that is self-development. And I also want to say that His Excellency Senator Okowa was a very kind man. He sent me to Harvard to study
health insurance, and leading the health system. It cost quite a lot of money, but he did. As if he knew I would be useful to the state. And so I'm one of the few people that have the concept of health insurance. And then I've been trying to pass that message across to my colleagues in the service side, general hospital, primary health care centers, to understand the concept of health insurance. It's a social service. It is not a service meant for cash and carry, you must make money from it. No. It's part of the contribution of government or even the rich to support the vulnerable people and indigent of any community.
So, a number of policy changes have been implemented in this commission of recent. What informed these changes and what is the target result?
I haven't run this commission for 8 years. There's a need for new direction. As to having used that 8 years to find out all the challenges, barriers, and then we new policy. So, key area that has been a challenge to the scheme has been how to get people registered into the scheme as easily as possible. So one of the new policies that our ICT must be upgraded to top notch. Today, you can sit any corner of this state with a handheld phone. You are registered, you pay, and the data comes into our platform instantly. And then, two again, today we have put a new policy that you don't need to go and fill a form for encounter. Like, oh, I'm at Ughelli General Hospital, I'm here, I'm filling and signing a form with signature. That is prone to a lot of fraud and a lot of other things. So we have a system called the facial encounter. If you want to take care, you just get to the hospital. Our agents, service monitors, we take your facial encounter, you smile to the camera, and it hit our server here. So when your bill comes, the two are married, and then the bill is paid. We also need to look at pay, the cost of care. Costs have gone up for quite some time. So the policy was from the board, increase the amount we are paying to providers to make them happy so that they can attend to our patients. So our capital went up. We also devised the payment system from the conventional listing item by item. We changed it to what we call the bundle payment system. Another policy we brought out is pre-registration of antenatal as well as under 5. Before now, Delta opened its gate wide. Once you are pregnant, you don't even need to register. You just walk to a facility and receive treatment. As that is good, very good, but it brought a very big challenge. Our neighbor states around us were not having that policy. And so in those states, you must pay a huge amount of money to get treated as antenatal patient. Cesarean section, 500, 600, 1 million naira. But the Delta is free. And so suddenly we start having huge influx of people from neighboring states, to the extent that the number of women that deliver in Delta are more than the women in Delta states. So where are they coming from? But we cannot continue. The law, number one, the law says resident of Delta state. Resident, whether you are Igbo, Hausa, Yoruba, Anambra, Bayelsa person, Edo person, as long as you are living and staying in Delta and working in Delta and voting in Delta, we care for you. All right? But you can't be staying in Port Harcourt, in Lagos, in Kano. When you get to the point of delivery, you jumper down, and then so the huge amount of money was being spent by government on these guys coming from across border. So I had to do something about that. I'm pregnant. Give me a health card, free of charge. You're not paying a kobo, but register. But before you register, you need to give us evidence that you're resident in Delta. Your name, that you registered in Delta, your BEDC bill that you have been paying bill for the past 6 months in a particular location, or a voter's card that you voted in the last election in a particular location. Abi? And so once you produce any of these three, we register you, we are a resident of Delta. Delivery free. So for the 3 trimesters in pregnancy, 9 months in pregnancy, we pay 45,000 for antenatal care. Free, government is paying. And then when you deliver, we pay another money again, 30-something thousand. So delivery, from the day you are pregnant to the time you deliver by ordinary delivery, about 80,000. If you have to do cesarean section, commission pay another 120,000 on your behalf. It's subsidized, mind you. So you can see the huge amount of money this government is paying. And so the policy, first, is to curtail influx, two, to ensure that our people receive better care. The hospitals are now happy to manage our patients. So another area of policy change has to do with redesigning even our operation in the system here. Before we came in, the bill system takes about 18 months to get a huge bill like from Arch processed. And so we came and I made huge files of 18 months, 10 months unprocessed. But I can tell you within the space of 2 years, we brought that down to normal cycle of bill processing in health insurance is 90 days maximum. Before you send the bill, you already know the amount. So the next policy was, how do we get the money to pay? We put in place this kind of operational to ensure that all our debts were having been owed money all over the place. And we ensure this money has been coming in. Government was not too clear about the picture here in terms of our debt profile. But I redesigned the financial system so apparent that every hospital knows how much we are owing, when we owe it, and the date it was owed. And I sent it to all the hospitals. They were able to correct it. Oh, no, you have paid us this, you are sending to me that you have not paid. This one you have not paid. And then we put it to, within a period, we now have a clean system of financial operation. At the button, the touch of a button, I can tell you the bills of a hospital, how much have been paid, how much is yet to be paid, and how to. Presented this to government, and government was very happy that the debt was not a ghost debt. Remember, the law says the government should put 0.5% of the monthly, yearly budget as equity contribution for pregnant women and under 5. But the present government is very meticulous about finances. He saw that, yes, we are owing this money. They released money, 1.6 billion, to the commission. And then we clear equity bills, pregnant women bills that have been accumulated, under 5 have been paid. So we must thank His Excellency, Right Honorable Sheriff Uborewore, for a marvelous work done. He cares. And again, under 5 is free. Your child is sick, you rush to the hospital to give your treatment. We also put a clause into that. You need to register, free registration, so that we can have your database with us, and also to prevent influx of non-indigents taking advantage of the generosity of Delta State. So we brought in initiatives to make access possible for some people that don't even have the means at all. Where we made a clarion call to Deltans to please come to the aid of people around them, the indigent around them. We've gone even further to get what we call finance line for those artisans, barbers, carpenters, hairdressers, who make money in piecemeal. And therefore it becomes difficult for them to pay bulk money. Even the 7,000 is a bit difficult to pay. And so we said, okay, don't worry. We'll give you a loan of 7,000. And then pay at the rate of 100 naira a day, 500 naira a week, and within 90 days, you finish paying the money.
Okay, so has there been any form of collaboration or partnership that have enabled this commission drive its vision and mandate this far?
Workers are punctual regular. Bills are being processed as and when due. People here work even Saturday and Sundays if they need to. Don't need to force anybody. So management here is top notch, I can tell you. Then our collaboration with other people. We can't do it alone. We are one side. There is a divide. Let's go to service side. A misconception between what we do and what you should do. Advocacy, a lot of training at the head office here. We have a top-notch training center, and we have been training even our staff here along with the providers. I said I've gone to training movement across the state in 14 medical zones, 11 official zones, and there are others. So if you add it to the 11, it's about 14. I've gone around all of them, and I've trained huge number of senior top management, and they have becoming to understand our relationship with them. It's a sweet relationship. Before they were talking of OS drugs, out of stock drugs for the enrollee of the patient of the commission. It shouldn't happen. We pay what we call capitation upfront. For example, the capitation for June have been paid already in May, at least at 1 week before June, to enable you prepare for the patient that will come in June for treatment. So no patient will come there and say out of stock drugs. It doesn't make sense. So we held meetings between us, HMB, DRF, Ministry of Health, and the hospitals, and we agreed. No enrollee of this commission should walk into a hospital for malaria, typhoid, headache, cough, anything. Outpatient treatment, and you say there's no drug. So they are drugs. And I'm happy the Commissioner for Health, Ministry of Health, HMB has provided extra money for them. In case the drug from DRF is out of stock, take the money in your purse, 1 million, 2 million there. Go to nearby pharmacy, pick the drug, and give to the patient. So no hospital in Delta now that should say a drug is out of stock. And in health insurance, there must be collaboration and cooperation for you to succeed. And so the first thing a health insurer like us must do is create a situation of cooperation between us and the provider. If you don't do that, the scheme will collapse. Today we have training, not only for doctors, we have training for pharmacists across the state, bill officers across the state, matrons across the state, in their own group. What are your problems with the scheme, bill officer? What are you finding difficult? Let us know, we train them. Pharmacists, what is the problem? Why is it that you are not, oh, this is the reason we explain to it. So we have this collaboration, macro and micro. Beyond the MD. MD comes here to receive a meeting. How many of you can he scale down the line? So we won't take permission from the MD, allow us to call the pharmacists together, allow us to call the bill officers together, the laboratory scientists, let them come, then tell us their peculiar problem with the scheme. And this have been working extremely very well.
Little wonder the commission has won a lot of awards within and outside the country. Can you reveal the secret, or would I say the magic ingredient or ingredients that is attracting these recognitions?
When I took over this assignment, I took it like it's my private business. The way I've run my private business successfully, I must say. And to drive my own businesses successfully, there has been one word: commitment, perseverance, endurance, loving the job as that is what you must do. So I brought that on ground. Coupled with the experience I've had over 8 years, again, I'm trained in this. I'm a qualified health insurer, a health leading in health system from Harvard, creating public value from Harvard, health economics from London. I have gotten all the particular definitions, qualifications to run this business. And so it's not too difficult to do. But having come to that, if I say all this I quoted as my background, and I get here and the government is not interested, money is not being released, for example, can I do anything? The workers' salaries are not being paid. So the first thing that makes this success story, whatever award we have gotten, you see them, is government. The strong political will of the former government and the present government. In this period of 1 year, 2 years, we have moved the population enrollment into the scheme from the initial 1.4 million in May 2023 to 2.6 million in May this year. And the highest in the country. The number 2 person is just 1.2. The state nearest to Delta is 1.2. We are 2.6 million. And so we've gotten all these awards. They came to us by dint of hard work. But I must also add, I have a very good board. The board has been very cooperative. Again, we have a good management. The directorship, 6 directors here, they have been here from the foundation. So I must thank the press. No matter how good you are working, if the press did not support you, work with you, propagate it will just be success within a pot.
In concluding this interview, would like to hear your message to residents of Delta State.
Without peace, progress eludes. Don't turn your community to crisis. Let the money meant for crisis to be used for development. Take care of people around you. According to the more agenda, give more to everyone around you. If we put all this together, Delta will be a greater state.
With that interview, we call it a day on the program Delta Health Insurance Scheme, and I hope you had some valuable insights to go home with. I am Eunice Emiazia. Join me again next week, same time. Remain blessed.
The Delta State Contributory Health Commission, they don't come again to remind all pregnant women when they for inside Delta State to say make they go register with the Delta State Contributory Health Commission scheme and get their health card. Even all pikin when they for 0 to 5 years must also register and get their health card before they go get any kind of treatment for our hospital. Because from now on, it go be say no health card, no free treatment, no health card, no free antenatal, no health card, no free delivery. Now the Delta State Contributory Health Commission, now they bring on this ogbonge tori o.